Welcome to another vital nursing video. In this video, you will get to test your nursing critical thinking skills by answering one question. Can you get it correct? Before we start, please like and subscribe for more videos like this to help you pass nursing school. Videos are uploaded frequently, covering multiple nursing topics. Now let's begin. A female client was employed as a client care technician in a hemodialysis unit. She recently began to experience extreme fatigue, being able to sleep for 16 to 20 hours at a time. She also noted that her urine was tea-colored, which she rationalized was a result of the vitamins she began taking to alleviate fatigue. She was diagnosed with hepatitis B. After a brief hospital stay, she was discharged to her parents' home. Her mother asks the nurse if any precautions are necessary to prevent transmission to the client's family. The nurse explains necessary precautions, which include isolation of the client from the remainder of the family, separate bathroom facilities if possible, if not, then cleansing daily of the facilities with a chloride solution. No necessary precautions because she is beyond the contagious phase. Laundering clothes separately in cold water with a chloride solution. Take a moment to pause the video here to think of your answer. Let's now eliminate each answer. Answer: isolation of the client from the remainder of the family is incorrect. Isolation is not necessary, even in the acute phase. Answer: no necessary precautions because she is beyond the contagious phase is also incorrect because precautions continue to be necessary while the client is in the active phase of hepatitis. Answer: laundering clothes separately in cold water with a chloride solution is also incorrect because clothes are to be laundered separately in hot water with a chloride solution. This leaves us with the correct answer to be separate bathroom facilities if possible, if not, then cleansing daily of the facilities with a chloride solution. Separate bathroom facilities are recommended. If unavailable, daily cleansing with a chloride solution is recommended. If we remember, hepatitis B is a blood-borne pathogen and the best way to kill the virus is with chloride solution. Okay, so how did you do? Leave a comment below saying whether you got the answer right or wrong. Thank you for watching. Remember, we post videos weekly, so check in often.